so far, we know that there's no Auditor General to counter-check what has been bought by senior government officials. We shall be speaking to a representative from ICJ this morning here on KTN News Center. We shall also be crossing over to the counties to talk to our reporters about matters of COVID-19. Our reporter Ibrahim Karanja will be giving us the latest update after Nyeri County reported its first COVID-19 in that county. My name is Brenda Zederadito. Always a pleasure having you tuned in to KTN News Center, hoping that you're okay and helping the government to flatten COVID-19. Let's begin with our bulletin on matters COVID-19, where Kenya has yet again recorded a triple-digit figure in COVID-19 positive cases in just 24 hours. The new figure of 147 drives Kenyans' total tally to 1,618.
Congratulations.
Kiambu County played host for Kenya's launch of the Menstrual Hygiene Policy 2019-2024. In the meantime, coronavirus continues. Trouble seems to rotate around the city. On Wednesday, Mathare in Nairobi reported 33 cases. Now government says it rounded up all contacts and has now recorded just one case. But Kibra, which had 14 cases then, has now jumped to 35.
Kibra, 35 persons. Langata, 15, and that's near Kibera as well. Makadara has 9, Westrans has 8, Embakasi Central has 6, Embakasi West has 5.
Nyeri County has made its debut to the COVID-19 list, raising the total number of counties affected so far to 32, an equivalent of 60%. Even with the latest 147 cases in a single day out of 2,831 samples tested, Nairobi has continued raking in the bulk of positive cases after interchanging the slot with Mombasa.
90 in Nairobi, 41 in Mombasa. Kiambu has another 3.
The government says though Kiambu County has reported relatively low numbers and is boosting its COVID-19 response handling capacity, the areas around the capital city remain red zones.
Kiambu County has recorded 39 cases, placing it at number 4, behind Nairobi at 835, Mombasa at 490, and Kajiado at 65.
So the most important thing is to make sure that young people do not go to the rural areas.
Some 54 healthcare workers have contracted the virus. In the latest figures, Kenya has lost 3 more people, taking the total death toll to 58. At slightly over 70,000 tests carried out so far, the numbers might not give a true picture of how things actually are concerning the COVID-19 situation. However, the government insists it is still on top of the situation. Mark Namaswa, KTN News.
Right, so that is Mark Namaswa, who has been keenly following up on these COVID-19 cases that have been reported here in the country. And of concern to the government is how Kenyans are handling COVID-19. The government says not so many Kenyans are concerned about the safety measures that have been put in place, like washing hands with clean water and soap thoroughly, keeping that social distancing, using hand sanitizer in case you're at a place where you can't access clean water, and even using a mask. So those are some of the concerns that the government, the concerns that the government have raised every time we have a press briefing when they're updating the country on matters of COVID-19. But now we are seeing that the press briefing is now being taken to the county levels. The first one we had at Machakos County yesterday, we had another press briefing from the CS of Health, Mutai Kagwe, and that was done at Kiambu County, where the government is going there to talk about COVID-19 and just see how the counties are prepared when it comes to fighting COVID-19 in the country. And now 2 first cases have been reported in Nyeri County. And I'd like us to speak to our reporter, that is Ibrahim Karanja, just to tell us on the preparedness of Nyeri County, owing to the fact that it has now joined the list of counties that have reported cases of COVID-19. Ibrahim Karanja, good morning. Kindly talk to us about probably contact tracing now that the county government of Nyeri has reported its first COVID-19 case. To our reporter Ibrahim Karanja later on, just to give us an update on what the county government of Nyeri is doing now that Nyeri County has reported its first COVID-19 case, even as the government continues to urge county governments to put more precautionary measures and more to have a lot of preparedness when it comes to COVID-19 in the country. But let's shift gears to matters of politics in the country. And the parliamentary group of the National Super Alliance, that is NASA, has removed 9 members of the coalition from all the House committees that was chaired by ODM chairman and minority leader in the National Assembly, John Mbadi. The asked members are said to have either publicly declared their support for Deputy President William Ruto or whose party loyalty is seen as questioned.
The closed-door NASA parliamentary group meeting was held at the National Assembly's main chambers and lasted an hour. 3 agendas were discussed: the budget and BBI process, leadership changes, and removal of rebel members from House committees. 9 MPs de-whipped from their respective committees for 6 months are Kenya National Congress Silvana Sosoro, John Lodepe, Catherine Wambilianga, Tindi Mwale, David Ochieng, Aisha Jumwa, Vincent Kemosi, Paul Katana, and Badi Twalib.
So these members have been de-whipped completely. They will not sit in any committee. They have to go through disciplinary action if they are to come back.
We'll also be dealing with issues of reforms, which are coming soon. You are aware BBI task force is just about to conclude its work, and these members have been whipped to work very closely with the leadership of the coalition in Parliament to make sure that the agenda of BBI is pushed forward.
Reaction was swift from some of the de-whipped MPs.
The reality is that Junet, who happens the whip, has been asking me to leave my party, ANC, and join ODM. I'm very happy that he has finally removed me. When he meets me again, he won't tell me issues of you need to come to ODM or you need to leave Musalia for you to be secure in committees.
Junet, umefanya kazi yako na wala haina haja ikiwa mahali umefanya kazi yako pia ubembelezwe sana juu ya njia nyingine zozote zile. We are happy for what you have done.
Ford Kenya's Kiminini MP Chris Wamalwa was removed as a deputy minority whip and replaced by his immediate neighbor Tongareni MP Dr. Simiu Eseli. Malindi MP Aisha Jumwa suffered double tragedy. She was de-whipped from committees and also removed from the Parliamentary Service Commission. Aisha will be replaced by Likoni MP Mishimboko.
The process of removing her has started today, and it is going to end very soon. So all those legalities will follow.
Ugenya MP David Ochieng, who belongs to Movement for Democracy and Growth, MDG, said his party has never joined NASA and neither does it caucus with it in the National Assembly. Ochieng said that Junet and ODM should accept MDG, beat them in the Ugenya by-election held April last year, and move on.
And I gave him the committees that were served by Honorable Chris Karan, who was serving in the Health Committee, and I told him go and serve with those committees because he also represents the same constituency. Now let him go and look with that party of his, Millennium Development Goal, which is called what? MDG.
Junet will communicate the changes to the Speaker for action. Patrick Amimo, KTN News.
All right, interesting turn of events right there when it comes to politics in the country. Axing of members of parliament who are said to be supporting the DP or they're shifting their political allegiance to other political parties. Now, away from that, and let's talk about matters procurement in government. And this morning, I just to have that conversation with Mumbi Mugo, who is a senior programs officer at the ICJ. Thank you so much, Ms. Mugo, for talking to us here on KTN News Center. As we speak right now, when it comes to procurement, during this time that the government does not have an Auditor General in the office, what can you say? Where are we as a country in terms of transparency and accountability?
Thank you, Brenda, and thank you so much for having me this morning. The truth of the matter is that the COVID-19 pandemic, presents a situation where we are fighting to save lives, but juxtaposed against it is also the war against graft or the war against corruption, because the emergency response that needs to be put in place also means that we have to, put emergency responses in terms of procurement. And what we have seen is that there is a lot of issues, and the Cabinet Secretary for Health in his press releases that he releases every day has also been mentioning what is happening in Afya House. We have also been following what is happening with the Public Procurement Information Portal to see if procurement information is being uploaded on the portal. We are also seeing a number of an increase of cases that are being determined or reviewed by the Public Procurement Administrative Board. Now that obviously a lot of awards are being awarded, a lot of contracts are being done, and the board is now getting more cases. So in terms of procurement, I think there needs to be a lot more information that is out there. There needs to be a coordinated approach. There needs to be guidelines that are put in place, to also respond to ensure that there is rapid response in matters procurement. And as you correctly said, the Office of the Auditor General is still vacant. So, raising a lot of questions and a lot of gaps and a lot of loopholes for graft.
And different government ministries are currently handling different issues affecting Kenyans. We have floods, we have COVID-19, and the government is right now doing more of spending. And so all money is leaving the government offices. So will it reach a point whereby even when we get an Auditor General, there'll be clean, there will be a clean book of accounts, because it looks like lots of cooking of figures. That is what is currently happening now, and it's a concern that even the CS for Health raised recently.
You will see that obviously counties, there is a county that a hospital was done in 21 days. You will see that also attention has been shifted. A lot of people now are fighting hunger, people are fighting the virus, people are fighting evictions, people are fighting floods, people are fighting other health-related diseases that are not COVID-19 related. So a lot of attention has been shifted to other things. But this morning, I'm here to just, shed light on the procurement, and also that as civil society, as interested citizens, we should also shift our attention to procurement, so that, and also counties should take this into account, so that after the COVID-19, when we are doing the audits, then we have a clean bill of health.
But then, and you're talking about the clean bill of health after COVID-19, doing that audit. It takes me back to what I'd asked you earlier. How are we going to ensure that there's a clean bill of health? Because one, we don't have an Auditor General in office. I would recommend a number of things. First of all, we must always remember that transparency is the key strategy to ensuring that we fight this war, not just the war against COVID-19, but also the war against corruption. And they are interrelated at this point, because then we don't have enough time to scrutinize what government is doing. We don't have enough time to scrutinize government spending. Our attention has been shifted to other things. And of course, Kenyans with anxiety and all the other things that are happening around them. So we have a few recommendations that I would give. One, I think the role of the Public Procurement Regulatory Authority should be at an all-time high, and they should come out to to publish emergency response guidelines in terms of procurement. We should also ensure that the contracts and the tenders that are being awarded are in line with Article 227 of the Constitution that promotes that calls for promotion of equitable, competitive, and fair bidding. And the Public Procurement Regulatory Authority should also now, publish market indices, market prices for the equipment that is being sold. We have seen a lot of medical supplies that are now on demand, and the supply is also at an all-time low. So, there are a lot of intermediaries. There is a lot of corruption, of course. And if we continue like this, then there will be situations where we will have maybe poorly done contracts. We can have poorly awarded tenders. We can even have a situation where we have suppliers who are not unqualified winning these tenders. So, Ms. Mugo, it's good you're talking about suppliers who are not qualified getting these tenders. You're just echoing what the CS for Health, Mutahi Kagwe, talked about 2 days ago, saying that the people who are at the Afya House building, who are trying to, give people who are actually carrying out the tenders, people who are supposed to deliver goods to the government, promising them goods in terms of, I'll give you this tender if you give me a kickback or something, which begs the question, because is there a procurement process that is being done right now that the country is in need of medical equipment or even food stuff when it comes to families that have been affected by floods and need humanitarian aid from the government?
Yeah, and I think that's the role of the Public Procurement Office, the PPRA, because I do not think that we don't have published, we have not published an emergency response procurement guidelines that we should be following and we should be using for procurement matters as we speak. So, but I must commend the government. The government has really been proactively disclosing information on, the funds that have been received, on the number of cases. Every day we have these updates. But I think we could do more in terms of where is this money going. Just last week, the president released the 8 key pointers, and there was the question of the 250 billion that is being distributed every week to Kenyans. And I think of importance is to have Kenyans understand how this money is being utilized, and also to question how this money is it reaching the people that are the most vulnerable? Is it assisting us in the first place? So
how should we open procurement to ensure that procurement is observed during this COVID-19? Because it's about, we need this equipment immediately. It has to be done. So the procurement process has to be done like immediately.
Yes. We must balance. We must balance the integrity of procurement. We must balance the need to save lives, but also the need to fight corruption. So I would suggest that we quickly get an emergency response procurement guidelines that will guide us in procurement. This also means that we will be observing AGPO, the access to government procurement opportunities, because I would imagine that what is happening now is that the bidders or the big companies that had been supplying in the Ministry of Health are still supplying now at the expense of maybe smaller companies, even at the county level, at the expense of affirmative action procurement opportunities that government has laid down for women. And I do not think that this is being observed. So one of the things we should do is to ensure that we balance transparency, we ensure that we balance integrity, and even though we need to have emergency response, we also ensure that we are looking at procurement and upholding integrity, upholding the principles of good governance in our constitution, and also not by stepping the legal framework that is in place. We are governed by the very the Public Procurement and Disposal Act that gives power to Article 227 of the Constitution. So even in terms of procurement, we should ensure that the process is fair, the process is equitable, and the process is competitive, and also ensure that there is no monopoly, because the current confusion that is there is very easy to have intermediaries, and it's very easy to have counterfeit goods in the market, and it's also very easy to get suppliers who are unqualified winning these tenders.
So, Ms. Mugo, lastly, so how is the government performing, in terms of access to information during this pandemic period?
In terms of access to information, the government is trying, and we must commend the government where it is really doing its best. However, this information, we should ask ourselves if it is reaching, everyone. Is it in a format that people can understand, can interpret? Is it reusable? Is it information that people can relate to? And we commend the Cabinet Secretary for Health for his daily briefings on how we are doing in terms of the cases for COVID-19. But I think there needs to be more information. The information on how funds are being utilized, in the information on how much the COVID-19 Emergency Response Fund has and how it's being utilized. I think there is still a gray area in that, and I think Kenyans would appreciate knowing how much they have, exactly how much do we have in the fund, where is it coming from, who is it assisting, and what is the criteria that government is using, to get to map out the people that really need help.
All right.
So, yeah.
All right. Thank you so much, Mumbi Mugo, the Senior Program Officer at ICJ, talking to us about COVID-19 procurement. You've heard it from her. It has to be a transparent exercise that all Kenyans, and that all Kenyans need to know what is happening when it comes to the using how the government is using public funds during COVID-19. But still on COVID-19, and the two first cases